We looked at the value of using blue dye in conjunction with the combined technique for sentinel node biopsy. Blue dye is, of course, standard of care. We all use the combined technique for sentinel node biopsy, but increasingly centers have stopped using blue dye because of the fact it causes adverse events, including the rare occurrence of an allergic reaction and anaphylaxis, but also the tattooing of the skin. And so we looked at whether that was a good thing to do or whether that was not going to be produce the same sensitivity of the original technique. I work with a number of surgeons. We all use the combined technique, but I then analyzed the identification rate using the results on the radio-isotope alone and the blue dye alone. And what I found was that the identification rate for the combined technique was 98.8 in our hands, and it was 97.5% with the radioisotope alone, and it was 92.5 with the blue dye alone. What it tells us is that the combined technique has got a very high identification rate, that using radioisotope alone can also produce high identification rates in good hands, but using blue dye alone is probably not a good idea.